So now we get to talk about something that I love to talk about. So does Jeff. We love this topic, is patient-generated health data. So let's get into it. You may be asking yourself, what is patient-generated health data? So good news is patient-generated health data has been around a long time. You already know what it is and you don't even know it yet. It is just any data, any information collected in between medical or healthcare or mental health appointments for patients, anything about their lab data, like you take a COVID test at home, that's patient-generated health data, right? It doesn't automatically go into the healthcare record. It doesn't automatically go into the patient's health record. It doesn't do that, right? This is stuff collected in between, right? Sometimes people are tracking their sleep or their mood, or tracking, did they take their medications on their calendar? Some people track their weight on their calendar. All of that is being collected all the time, helping patients to get a better sense of what's happening to their health, right? And there's a subset of that information that patients will come into appointments and want to share with us, right? And so that's the big realm, the big picture term for patient-generated health data. Sometimes in the literature, you'll hear it called other things, but that is the big picture of really what it is. To help define what patient-generated health data is, a few years ago, we realized that we needed to create a VHA directive to be able to define this, discuss roles, responsibilities, all the key information. And so that has been published. So VHA Directive 6506. And so that was published, I think, April 2021, I believe. COVID, we're doing a lot, and it became a big blur, but it was during the COVID times. And so it has been published, and it's got some really valuable information. So if you're like, hey, this is new terminology for me, that's where you start. But I will show you at the end of this presentation an entire repository where we hold all the information all together so that you don't have to hunt and peck all over trying to find this. So, like I said, there's some examples. Some of the examples of patient-generated health data are maybe you track your blood pressure at home. I have a digital blood pressure monitor that I use. My doctor didn't tell me to do this. My doctor said, hey, you might be interested in doing this. And so I track my blood pressure because I'm very interested in it, right? And then I track it in an app that I control. So patients are doing all this type of stuff. I track my workouts. I track, if I take a COVID test and all of these things. And we ask our patients to do lots of things, and our patients will be interested and will do a lot of these things on their own. And again, PGHD as a concept has always existed. So I know a lot of times people will start to think of patient-generated health data, and first this is a long, clunky term. But when you really think about it, our patients have always brought in information about what's happening to them in between our sessions, right? And sometimes we were formal about that. So for me as a psychologist, I've countless times, it is standard practice for me to have patients track their mood or their sleep or, whatever it is that we're trying to make behavior changes about. It is standard for me to have patients track this, right? And so the only big difference now is that with all these mobile apps and digital platforms, patients are tracking these in a lot more efficient ways, and they're able to track a lot more data than ever before. Now, this creates some challenges for us as a healthcare system. How do we get that data in? How do we get it in safely? How do we display that data across all these different devices and sources and things like that? What amount of that information do we need to be paying attention to or not, right? Everybody's very busy anyway. But when you step back and you say, you know what? It's actually not changing too much of what we're doing, right? We've always had PGHD before, and we do have systems in place for a big chunk of this. So it isn't like we're recreating an entire wheel. So I always urge, healthcare staff to keep that in mind. We've always wanted to know what was happening in patients' health between appointments. So that's really what PGHD is. But all those other details, we are working through all those too. Now, like I said, patients they can always track their anything they want to track on paper and pencil. And they can do that now too, if they don't want to track things digitally. But no, your patients are tracking it digitally, and they are going to bring their information in digitally, right? And they're really trying to be able to share this information in the safest possible way. Okay, so pen and paper. Other ways are Fitbits, Apple Watches, Garmin's, glucometers, devices, digital blood pressure cuffs, things like that. We also have an app I'll talk about a little bit called Share My Health Data that we've put out. The VA has put out to be able to, allow for the syncing of these devices and the pulling in of this data, and have veterans be able to control how that data goes. And also we have lots of other apps and mobile and web platforms all across the VA that collect lots and lots of patient-generated health data. Behavioral Health Lab, e-screening, Annie, VA, My VA Images, on and on and on. All of these are collecting patient-generated health data all the time, and they are of huge help to our patients. And when it comes to, wearable activity trackers, I keep showing mine. I've been wearing a wearable activity tracker for at least the last 15 years continuously. There's been times that I was wearing multiple because I wanted to make comparisons. So, although I was, on the I was one of the first kind of heavy adopters of these. There's a whole subset of us in the population that were just, saw the value of wearable activity trackers a long time ago. But this has caught on, right? As of 2022, it was expected, in 2021 that there would be over 1 billion activity trackers out there. And this is absolutely the case. This is what we have seen. And also we see that veterans use this too, right? One of the barriers that a lot of healthcare staff identify when saying, patients our veterans are not going to use this. They don't have access to this equipment, whether it's a smartphone or activity trackers or anything like that. They'll say, well, they don't have them and they're not interested. That's what healthcare staff will say. But the truth is, the research shows that's not the case. The vast majority of veterans, and in fact, even older veterans, do in fact own these devices. So cell phones, tablets, smartphones, computers. And for the subset that don't have them, we do have programs in place to be able to provide that with others. But also we look, even when we're comparing older veterans in the VA healthcare system compared to older adults across the US, there's actually a much higher percentage of this device ownership for our older veterans. So I'm just saying that because so a lot of times healthcare staff will kind of discount or dismiss that patients will be interested in this because they'll say they're not interested, they don't have that. But that's not the case. Our veterans are far more tech savvy than many give them credit for. And when you actually look at the objective data, they really are. They have more devices and tech savviness than the general adult population. And they are using them. They are using these devices, and they are sharing this information. And certainly throughout COVID, we saw already veterans and the VA, we were leaders around the world in telehealth utilization. We had a healthcare system that was set up to deliver healthcare virtually in a way that many other healthcare systems were not set up to do. But we were able to all pivot really quickly during COVID because we were set up that way. And so what we want to do now is be thinking about other ways we can help patients leverage all the resources within our healthcare system to be able to access those resources when they need them, where they need them, right? And when we look at the population trends in virtual care, we just see more and more utilization of these and more benefits coming from all of these technologies. Now, Jeff talked about our VA mobile and web apps. And, I do urge everybody, if you have not done so already, go to mobile.va.gov. There is an entire world of mobile and web applications out there. And some of those come out of Office of Connected Care. Some of them come out of different areas of the VA. So VA Health and Benefits, you see that first icon there that says VA. That is VA Health and Benefits. That didn't come out of Office of Connected Care, but it is a brand new app. It is fantastic. If you guys haven't checked it out yet, please do. And then there's also a whole entire suite of apps that have come out of the VA's National Center for PTSD. So that's a team out of Palo Alto. And so all those PTSD coach, insomnia coach, COVID coach, mindfulness coach, couples coach, all of those wonderful apps, those are with our partners in National Center for PTSD, doing a wonderful job. And then there's other groups across the VA that are building apps as well. So we all work together to be able to provide these important resources to our veterans. And we also want to take a look at, just a little bit more of the population trends. Again, we're going to be talking about patient-generated health data. And again, one of the first barriers that healthcare staff present is, I don't know, I don't think patients are going to want to do that. First of all, they are already doing it, and the data shows it's only increasing. So that can't be the reason why we don't get on board and really dig into understanding how we can best meet their needs. Okay, so this is showing some more data about just the increase in remote patient monitoring, telehealth visits, and also when we look at patients, why would they use these sensors, wearables, remote patient monitoring? Why would they do that? And for the vast majority of patients, they say it allows me, or for healthcare staff, they say it allows me to provide care to my patients remotely, or allows me to extend my reach, allows patients to be supported in their behavior change process or healthcare journey in between those healthcare appointments, right? Okay, we talked about sensors, wearables, remote patient monitoring. So there's all this is in the entire realm of patient-generated health data. There are, wearable sensors, there's implantable devices, there's all types of things. Now, some of these have very specific programs related to them, right? And you typically, so remote patient monitoring, home telehealth, there's very specific criteria for what devices are needed to track that information, who's going to be contacted if something goes wrong. There's very specific processes in place, right? So we've had all that for a long time in the VA, right? So we're not changing. What we're going to be talking about today for patient-generated health data doesn't change any of that at all. What we're doing is talking about extending the reach. So if patients were to come in that do not have a chronic illness that they need a lot of monitoring for. If, let's say, I'm just tracking my heart rate and my sleep and my steps through my Fitbit, how can I share that with my healthcare provider? Okay. And the concept here is with all these kind of wearable devices and also all this other patient-generated health data on moods and sleep and all these things can come together. And if you can see, if patients can see what's happening, they can better be able to see, oh, I see when I sleep poorly, I slept poorly, and look at my mood was like that. You can start to make the connections between all these things. And we all intuitively do that, but this starts to really make it very clear how all of our behaviors impact other behaviors, right? So if I eat really poorly one day, maybe I'm feeling sluggish the next day, right? If I eat poorly one day, maybe I'm going to sleep poorly that night. And I start to see this impact, right? And then only then I can really start to be able to make those changes. And also then I can see those changes happening over time. And it really is this like motivating feedback loop that begins to happen. Okay. So one of the other things is, patients are already doing this. They're already collecting this information. Sometimes they'll write it down on a piece of paper. Sometimes they'll, wear it like this. Sometimes they'll track it in an app. But they've done a bunch of research into would they even want to share it, right? There's a certain element of what happens in a person's life that they might not feel ready to share with their healthcare provider. And that's okay, right? We're not the police of everybody's minds. That's not the goal here. But it is our goal to be able to provide an avenue for patients to be able to share information that they think is important. Will it actually be clinically important for us to be able to make a diagnosis or change a treatment plan? Maybe yes, maybe no. But they do want an avenue to be able to share this information. And that's what research shows us. Research shows that they are willing to share. 90% of those that were surveyed said that they were willing to share with their doctor their wearable data, that 90% say they were willing to share with their nurse or other healthcare professional. And 75% said they were willing to share the data with a family or friend, a family member or friend. So they are much more willing and interested in sharing with those folks that are actually engaged in healthcare discussions with them, right? Even more so than their friends and family. So that I was surprised by this, and it was, but it really makes sense once you think about it, right? Also, there's a ton more research that I'm not going to go into here, but it is available in the resource page that I'll show you later. We know exactly what types of data patients are more or less willing to share too, right? They're very willing to share all their sleep information with us, especially if it's a healthcare staff member that can help work with them with that, right? And there's other types of information maybe they're not as willing to. Okay, let's talk about some of the benefits of collecting patient-generated health data. So we've talked about benefits for the veteran. They want to share this. They are already thinking about this, and they want to share it. But there's benefits on the healthcare staff member's side as well. It's really important, if we just see a patient once a year or once a month or something like that, we really don't have. Our standard of care now is that's what we do, and we make a lot of assumptions about what's happening to them, all in that in-between time, right? And our standard of practice is to make a diagnosis, develop a treatment plan, deliver that treatment, having an assumption about that. And the more we can really understand about a patient's life, the better we can refine those, right? Does it always change your diagnosis? Maybe, maybe not. Does it always change your treatment plan? Maybe, maybe not. That's our job as clinicians to be able to weed through that, right? But then also important is it allows us to identify meaningful health trends over time. If patients just coming into the first time, some psychologists, so they may say, I've been feeling depressed. And maybe I've been seeing them for several years. Maybe that's the first time they've said that, but maybe they've been feeling that for a long time. Well, it's hard for me to establish trends over time if I don't really have a baseline. That's my initial baseline, right? And so it allows us to, identify these issues earlier on. and communicate that with the folks that can help, and also track those patterns over time. It's really empowering for the patient to be able, they are absolutely engaged in their care. If they are bringing any kind of insight into their life between their appointments, into that healthcare appointment, there's a reason for it. Even if they're not articulating it in a way that's immediately actionable for you, they are trying to communicate something that is valuable to them about their health. And so I know, I'll give you an anecdote for myself here. There's, in that if we don't listen to them, they will be very disengaged. And that's our fault, right? That's something we need to change and understand that we can have that impact on disengaging of patients. I know for myself, there's health issues that I've had in the past. And then I said, okay, well, I'm going to learn as much as I can. I'm not a physician, but I'm going to track all these things that I think are important for this. And then I'm going to bring all that information into my doctor and have a discussion, right? And so I've done that in the past. And there has been a time that I said, hey, look, I tracked all these things for the last few months. I think this is valuable information. I don't know exactly what it means, but let's have a discussion. I've had the experience, and I know many patients have had this experience, being totally dismissed. Okay, well, that's not what we do, and that's not how we track things, or whatever. And then, so my end result was feeling like, okay, they don't want to be a partner in the things in my health with me. So my end result was I got another doctor. And I've had colleagues that have described the same exact thing. They just said, I'm just going to go get another doctor. This person isn't willing to listen to what I'm trying to say because I'm not using the right words to articulate it to that person, right? So we don't want that. We want it to be a shared decision-making process, and this facilitates that discussion, okay? So we're thinking about holistic treatment plans. We have to be thinking about how having that better view of the holistic health of a person can really facilitate their health journey in ways that make sense for them and that they're going to be really eager to do. Okay. But we do have barriers, right? We have a lot of barriers for making this happen in the way that it could and should happen in terms of patient-generated health data. So when we first really started along this realm in the digital collection of patient-generated health data, the digital collection, the digital transfer of that data, the storing of that data, and the displays of that data on both the healthcare staff and the veteran side, when we really started getting into how should that process go, we realized, we're really a long way from having this really clarified. So some of the barriers in that process are overall knowledge barriers, just like, what does patient-generated health data mean? What is solicited data? And we'll talk about that in a little bit, things like that. We saw a gap in policy, so that's why we developed the policy. We saw a gap in, there wasn't an operations manual across the VA in this big picture patient-generated health data. So we've developed that, and I'm not sure if it's been published yet or not, but it will be soon. And also, we identified a big gap in, we had published clinical competencies in the use of patient-generated health data, but those published clinical competencies were not yet translated into competency-based training, right? So that was about 2 years ago. That's where we were. Now, where we are now is we do have competency-based training. We do have a policy. I don't know if the operations manual is published yet or not, but it soon will be, and it will be in the repository of information that I'll show you in a little bit. Okay, so let's kind of just break it down. What are things that healthcare staff need to know about patient-generated health data? So for some of the things that you need to know are, for some patients, there are some technical barriers, right? There's some patients that if you're saying, hey, it might be helpful if you're describing sleep problems, you took a insomnia severity index standardized assessment, and it indicates you're having some issues with insomnia. And you may want to track your sleep habits for a month. Either they can track it on paper and pencil, everybody has access to that. But let's say they say, hey, you know what, I would rather kind of track it with a wearable. Maybe they have access to that and maybe they don't. Thankfully, in the VA system, we have a lot of options for accessing devices that patients don't. But it gets a little bit of there are still some technical barriers there, right? Also, another technical barrier is, if you haven't done this before, you might not quite know about the volume of data that's going to come in and how you sort through that. What's the best way to sort through that? Then things like, how do you code it? How do you code that time that you spent doing that, things like that. And also we have some technical barriers in interoperability, right? We have Share My Health data, which I'll talk about in a little bit, but that allows the syncing of devices, but it doesn't allow the syncing of any device out there at all. There's a subset. So then there's some, our ideal end solution, which is patients track their data however they want, and then they share whatever subset of that data they want, and then we're able to view it and they're able to view it. We're not quite there, right? Where that's the ideal end. Hope, we're working towards that. But right now, it's not a perfect, seamless process. But we have made huge strides. You guys, you might be blown away with the strides that we made. It's pretty exciting. So I did talk about the VHA directive, and I do have that live link to it. So that is the first place to start, right? Is that directive. But we also have an entire PGHD community on a Blackboard platform that has access to this directive, all the competency-based training, webinars, flyers, videos, dashboards, everything. But this is really, like, if you haven't read the directive yet, read the directive. We spent a long time trying to get the wording right, but it is really just the start of all the other big chunks that we're working through. So there's a lot of ways we can categorize patient-generated health data. And again, I'm talking big picture patient-generated health data, whether it's paper, pencil, digital, whatever. There's times that there's solicited, suggested, and unsolicited. And to be honest, there's overlap. There's not discrete categories. So let's talk a little bit about what this is. Solicited is data that is specifically asked for specific use, right? So it's collected, shared by the patient in response to a specific direction of the healthcare staff member. Hey, you have insomnia. We're going to track your sleep. We're going to track it this way. That's solicited. And so all of the VA remote patient monitoring, home telehealth, those, disease management protocols, things like that, those are all solicited and everything is very defined. Could you be soliciting data from a patient and it isn't within remote patient monitoring? Yeah, you can ask. You can solicit that data, but there's different, and that's where the overlap of these categories start to happen. So, but understand that there is a subset of this that we are directing patients to do. We have always done this, okay? Then there's a subset that we're suggesting. So when throughout COVID, my blood pressure kind of went up a little bit. I went to the doctor and it wasn't any emergency situation, but my doctor said, hey, you know what? After today, you may want to go to CVS and you may want to get a digital blood pressure monitor and just, begin to track it, right? Just a suggestion. That my doctor wasn't saying, then you send it in to me and then we're going to do something about that. It's just a suggestion. I could have done that or not did that. Of course, I did do that because I love this stuff, and I wanted to get a handle of my health, right? And then there's unsolicited. So like my doctor didn't ask me to wear a wearable activity tracker. I do that because I want to do that, right? And I have the right to be able to do that. And that helps me with my health, my management of my own health. And so the vast majority of patients are tracking things and you are probably not aware of it. And that's okay, right? I don't think it's relevant whether my doctor knows I'm doing this or not, right? If it's relevant for certain chronic illnesses I have, then that has a different discussion, right? Let's talk a little bit about the data flow, because again, the whole realm of sources, potential sources for patient-generated health data is everything, right? Paper, pencil, they're tracking on their calendar. We're not policing any of that, right? But when it comes to PGHD flow, as we have it defined under Office of Connected Care for right now, we have a Share My Health Data app that can pull in data from those aggregator apps like Google Fit, Apple Health that comes standard on all Apple, iOS devices, other third-party devices. I can pull my Fitbit data into there. I can pull my Apple Health data into Share My Health data. Also, I can pull different VA-issued devices, not all VA-issued devices, not all third-party wearable trackers, things like that, but a subset. Okay, and we can pull that data in, and that goes into a patient-generated health database that's secure, that's under the VA, but it's separate from the electronic health record, right? When there's some pieces of that data that comes into the the PGHD database that's separate, if there's some elements that are relevant for clinical care, then we do, copy paste those elements into the patient's electronic health record, okay? And then all of that data from that PGHD database goes into this analytic environment and then is displayed in different dashboards in Virtual Care Manager. And we see them in Power BI dashboards. So, and patients can view their data and track their data through Share My Health data, but also other apps too. Maybe, I'm checking my Fitbit app. I can pull it in through Share My Health data, but I can also go to the Fitbit app too, right? Okay, so talked about Share My Health data. Share My Health data was launched in May of last year, and it was created to allow the connection of devices like Fitbit, Garmin, Apple Watch. You can pair Bluetooth devices. You can sync up that data from Apple Health or Google Fit. Also has daily dashboards. You see the link on the bottom. The link on the bottom is really important because within that link, you'll be able to see an FAQ section. Within the FAQ section, one of the most often asked questions that people ask is, well, what devices can I sync? And so there's a whole list of all the ones that are currently capable of pulling in. So that's really important for you to know and patients to know for this. And then patients can track things over time. So this is a really, really important piece of that big picture puzzle of being able to pull that data in and have this seamless process. And here's a little bit of what that looks like, setting it up, what the dashboard looks like, how patients are going to see this. And in addition, analytics may be performed on patient-generated health data from individuals, larger populations, so that we can also begin to see these big picture trends over time as well. Allows us to have clinical useful insights. And I'm going to show you some of the displays in a little bit, but you just saw some of the displays that patients can see through Share My Health data. But we're doing, we have this amazing team in Office Connected Care led by Dr. Terry Newton, Dr. Neil Shah. They are doing incredible work in this area, trying to work with clinical subject matter experts in the field, working with human-centered design, making sure that we have data displays so that healthcare staff can identify those meaningful trends over time in a way that's going to make sense. Okay, so how that data flows, patients collect that digital patient-generated health data. They sync it up with that Share My Health data app. Patients can, choose to sync certain things, certain subsets of that data, and then that data for the healthcare staff member is viewable in Virtual Care Manager. And so here's an example of what that dashboard looks like for blood pressure, for example. So this is a healthcare staff view. They've logged into Virtual Care Manager. They're looking at they're looking at the dashboards for blood pressure. This is what they can look at, and you can filter. And what's also interesting, you'll see there's an overlay of electronic health record data and patient-generated health data. So you can toggle on and off, because you might see, okay, maybe they took a blood pressure, once a year for the past 5 years or whatever it was, but maybe they're taking their blood pressure at home once a day or once a week. So you can start to see, wow, what kind of patterns are happening with that more frequent data, and how does that compare to that electronic health record too? So it's really interesting flexibility in how to see this data and how valuable that patient-generated health data is in providing insights. There's also a clinical decision support console, or console, and where you can identify a lot more trends. And so there's 2 hyperlinks that are this is a hyperlink here, so you'll be able to go in and view it there. And here is when you first go in and you hit the clinical dashboards for patient-generated health data in Virtual Care Manager, this is what you begin to see. They're working with human-centered design. They've made huge progress in making this look more user-friendly, but there'll be a lot more work in this area to make it even more so. So you can start to see how valuable these insights are. Right? If this is the whole gap of information that we did not get before, right? This is all the data patients are choosing to share for all the things that are happening to them between appointments. So it does provide this valuable insight in addition to what we're collecting in between. Okay, here's a view of their glucose dashboard through patient-generated health, patient-generated vitals. So you can also see that data over time as well. Okay, so now that we're getting to the end, I want to talk. You might say, okay, this is great, but where do I start? So what we've done to make this easy is take all the resources, training available, whether it's veteran-facing or healthcare staff-facing, because you need access to the veteran-facing materials too, so you can hand it out to patients and share it with patients too, or have those conversations. We put it all in one spot. We do have a public-facing patient-generated health data page, so anybody can access that, anybody can see it, but really when it comes down to all of the data for healthcare staff, all the training resources, it is in the PGHD community in the Connected Care Academy. So Connected Care Academy is on the Blackboard platform. It is your one-stop shop for all virtual care training, and the PGHD community is the key place you want to go. And there's a QR code. But these are just a snippet of the huge amount of resource that we have. And for many people, maybe we do have durable accredited training modules in there that you can go through TMS and you can take those. Those are fantastic. However, you might say that's TMI for me right now. I want to see a 2-minute video. Do you just have a one pager? Do you have just a fact sheet? Hey, and you may be the type of person like me that you're like, I want to see the published clinical competencies. I want to see the policy. I want to see the operations manual. Whatever is what you need, where you are now in your patient-generated health data learning journey, we have tried to provide that information, develop and provide that information. So we have short videos, we have durable trainings, we have webinars, we have fact sheets, we have policies, we have guidance, we have additional resources. But again, we've been working on this for about 2.5 years, and we have I'd say about 5 more years to go to be able to really get a good thorough, just comprehensive set of resources for you. So as you're working through and you say, hey, you know what, this isn't there and this is what I need, let us know. And that's when we can begin to develop these things. I want to highlight those dashboards that you saw earlier for Virtual Care Manager. In the PGHD community in Connected Care Academy, I have direct links to all those because I want to make it as easy as possible for you to access exactly what you need when you need it, right? Because just like we want to provide that to patients, we wanted to provide that to each other as well. So you'll see in that PGHD community, there's an entire section with live links and descriptions and instructions for how to access these data reports and dashboards. And I also copied and pasted them into this slide as well, so you can easily access them too. And here you can see we have quite a bit of resources for veterans as well. So it might be patients are not sure how this might benefit them or not. Patients want to try this but don't really understand how this works. Well, we have fact sheets, we have short videos, we also have help desks, and like Jeff said, we have virtual health resource centers, and we have the link there. We have 36, I think maybe 37 live now, but we have about 67 facilities that are in the process now of building their virtual health resource centers with us. And so very soon we'll have about 100. And so we are quickly creating that network of resources all across the VA healthcare, all VA medical centers, to provide that on-hand support to patients and also healthcare staff when they need it. Okay, so let's hit the key takeaways. So in this, today we talked about how PGHD supports veterans and also healthcare staff in gaining this greater understanding of their health, their wellness, and giving them the resources they need to be able to really track and manage that in the way that's meaningful to them. And although patient-generated health data does not replace standard medical care, it really does augment and support it in many ways. And also patient-generated health data, patients have always been collecting this. It's only now when it's in this digital format that we've had to, kind of step our game up in a lot of ways and allowing them to share the information that they want to, when they want to, with us, and creating technical platforms to allow healthcare staff to be able to get the meaning out of that data in as quick a way as possible. And so patients are responsible for tracking this. They just will. They're doing it already. And it's our responsibility to understand that they are doing this, what we can do to help facilitate that shared decision-making conversation, and also to understand how that patient-generated health data may or sometimes may not contribute to our clinical decision-making and what those steps are and what to do. Here are the key resources. So these are the very important links. PGHD Community and Connected Care Academy, that's the VA healthcare staff's repository for all your training and outreach information for PGHD, but also we have a PGHD public-facing webpage. You'll see there's far fewer materials in there, but that's for anybody to access. And we also have Virtual Care Manager, public-facing page. We have a Virtual Care Manager community, and we have we have a promotional toolkit. Also Share My Health Data. So what I described earlier, that Share My Health Data link with the FAQs on mobile.va.gov, where you have that list of all the devices that you can currently sync with Share My Health Data. Very, very important. So that's there. And we also have a promotional toolkit. And with that, I want to thank you guys for this incredible opportunity to allow Jeff and I to have this discussion with y'all today. You guys are an incredibly important piece of making this a reality across the VA, not only in the, making this happen at the facilities, but also in opening up a community dialogue with Office of Connected Care to ensure that we are creating the materials, the training, the dashboards that are going to provide you the most value. So we thank you, and we hope that this is just the start of many conversations so that we can all together provide the best care possible to our veterans.
Well, this is Lynn. Oh, Jeff, did you want to add something?
No, I just wanted to thank Dr. Armstrong for the wonderful presentation, all the work that's going on. I did want to make a footnote in the growing body of knowledge that's out there with respect to PGHD and the holistic picture it provides the clinical team about the patient. Yes, there is that clinical stuff or the EHR data, that they make those hard and fast decisions, clinical decisions for it. But it's that holistic or that patient-generated health data that provides that holistic picture, that's so critical. And that's what the growing body of knowledge is showing. So thank you.
No. Well, this is Lynn, and I want to extend my thank you to both you, Jeff, and Dr. Armstrong for this excellent and very informative presentation on who is the Office of Connected Care and also the world of patient-generated health data. I know I learned a lot here from it. And I also want to thank you, Jeff, and also Charles Henderson for answering the questions in the chat window. I think we got to most of them. If we did not get to them, please just put them in there and we'll forward those questions to both Jeff and Dr. Armstrong. So once again, we really want to thank you for your time, your expertise, and sharing it with our community. And I'll hand it over to Danielle to see if there's anything else for wrap-up.
No, Lynn, I echo your sentiments. What a fantastic presentation. It opened up just a plethora of opportunities and questions for the audience. It was so well received, and hopefully you'd be willing to come back for a part 2. We will be in touch. And for anyone that did not register in advance, just a reminder, reach out to me via email and I will assist you with that after the call today. So thank you again to both of our presenters. This was fantastic.
Have a great VA day.
Thank you.
Thank you. You too.